All right, Dr. Cochrane, thanks for coming today. Tell us a little bit about how you first learned about Perio Protect, please.
Well, I was exposed through the literature, a couple of magazine articles about Perio Protect and what they purported to do, and then Dr. Dwayne Keller, who's the inventor of Perio Protect, provided an interview article, and I thought some of the points that he made and some of the promise that Perio Protect held, that it was worth my while to go take a course and see what the information was about this particular product.
Your talk today was titled, "You Don't Know What You Don't Know." What would you tell people who are listening to you today what they don't know about Perio Protect?
Well, the Perio Protect trays are so foreign to the traditional treatment of periodontal disease, and I've been a periodontist for 35 years. I understand the nuances of every little technique in controlling periodontal disease, and trays were so unusual, and particularly when I started to use them, I looked back and I said, wow, look what I didn't know. And of course I had no clue I didn't know that. You know, at the time I was probably 55 and feeling pretty self-satisfied, thought I'd seen about everything there was to come down the road. And then these Perio Protect trays came down the road, and they've been fabulous.
How has it changed your practice?
Well, Perio Protect does several things for me. It takes a lot of the ability for a patient to take care of their own mouths out of their hands. They don't have to brush just right. They don't have to floss just right. They don't have to toothpick just right. If they put the trays in their mouth, which anybody can do, my arthritic patients can do it, my Down syndrome patients can do it. If they will wear these trays, they get substantial improvement. So it helped in the oral hygiene section of my practice. It changed dramatically the need for maintenance therapy. The traditional technique for controlling gum disease has been around since the 60s, and that is to see a patient every 3 months and to clean their teeth, and that's an effective mechanism. It probably works 95% of the time. It has its exceptions and its faults. But once you introduce Perio Protect trays, all of a sudden patients who bled and were inflamed and red, despite their best efforts, despite my staff's best efforts and my best efforts, all of a sudden these patients weren't just doing well, they were doing fabulously well. And as a result, they didn't need as tight a maintenance program. So that certainly freed them up and freed some of my staff up to help other people. And then finally, over a period of time, I realized that trays will handle gum disease deeper, more severe than some of the techniques that were available before that. And so it has minimized, hasn't eliminated, but it has minimized the amount of surgery, periodontal surgery, that I need to do. And I think that's a blessing to my patients. It's just common sense. Patients like to avoid surgical procedures.
For patients who are really trying to understand their disease better, can you talk a little bit about the importance of bleeding for them and why you recommend tray delivery of medication for bleeding?
Well, patients sometimes with very severe disease do not see bleeding. And the reason they don't is they don't know how to probe into the depths of this damage. And commonly, I'll ask a patient, do your gums bleed when you brush? Do your gums bleed when they floss? And the answer is that I'll get no. And I pick up a mirror and a probe, and I probe a fairly routine pocket, and whoosh, I've got blood. And so it isn't that they then don't believe me, then they know they bleed. And I teach my patients how to look for that bleeding. And the comment I use is that if it bleeds today, you didn't clean it right yesterday. the bottom line is that if you probe an area gently and it bleeds, there are bacteria in there, and the ulcerative and the inflammatory process is going on. And when that inflammatory process is going on, you're at risk for bone loss, and you're at risk for heart disease, stroke, diabetes, Alzheimer's, pancreatic cancer. There's a significant number of diseases that you're at risk for if your gums are bleeding. And it's not difficult at all, once a patient is using Perio Protect trays, for they themselves to tell the difference in the amount of bleeding they have. I have an awful lot of enthusiastic patients.
So for dentists who are really thinking about how Perio trays are helpful in a practice, can you talk just briefly about what kinds of patients you may recommend trays for, in which situations?
Well, I don't recommend Perio Protect trays to all of my patients. I have a reasonable percentage of patients, I'm sure 50% or more, that conventional treatment is sufficient. Okay? They brush, they floss, they toothpick, they get their teeth cleaned periodically. They don't mind getting their teeth cleaned periodically. And the number of bleeding points that they have is minimal. They don't have any areas that are chronically bleeding. And so for those patients, I'm quite content to treat them in the traditional fashion. But I also have patients who, despite my best efforts and their best efforts, while they may not be losing bone, they may be losing bone, they may be getting worse from a tooth point of view, they're certainly bleeding all over the place, and they are at risk for the multiple health problems that are associated with periodontal disease. So that's the first patient that I will recommend trays to. I get patients then that have a lot of root caries, and I use my Perio Protect trays as fluoride carriers, and I have these patients use a fluoride gel once a week, and that's been quite effective. I use Perio Protect trays to protect my dental implants. I use Perio Protect trays to protect cases that have a significant amount of crown and bridge work. We all know as dentists that eventually cement fails and you get washout, and through either hydraulic pressure or diffusion, these medications get up under crown margins and provide those crowns quite a bit of protection that you would not get through routine brushing and flossing.
And if you would be talking to a doctor or a dentist who's really considering a Perio Protect course, how important is it that the hygiene team understand Perio Protect and know how to implement it?
Well, as a periodontist, I make it a point to check every patient on recall. And do I actually get it done? No, but I certainly, sometimes I'm in the middle of the surgery and I can't get away, but I certainly check 90% of my patients. And when I see a patient, they've been cleaned up, okay, and their gum tissue has been beat up. And so I don't know what that patient looked like when they walked in the door. I have some information from the data we collect with bleeding points, but I have to rely on the experience of my hygienist to tell me this patient is doing well, or they have some borderline areas, or they're generally failing. And my hygienists give me that information, and part of why they give me that information is I took my entire staff to Perio Protect training so that they understood the science behind trays. So they saw the cases that I was seeing and the improvement, the tissue shrinkage, the improvement in pocket depth probing, the gain in clinical attachment loss, the sharp drop in bleeding. They had an opportunity to see that, and so that they develop some enthusiasm for these trades. And then as time went by and they themselves saw the benefit of trades, how a patient would go on trades and go from 30 or 40 or 50% bleeding points down to 1%, 0%, 4%. That made their lives so much easier in the process of the work they do, that getting them on board through education, I felt was a key point.
Thanks so much for your time today. We really appreciate it.
All right, thank you very much.